Welcome, welcome! We will cover ICD-10-CM coding guidelines for COVID-19 and provide easy-to-follow instructions for students learning how to assign ICD-10-CM codes. Let's take a look at a small video for these guidelines. Don't let this overwhelm you. We will cover each guideline for COVID-19 individually. Grab your ICD-10-CM coding manual and prepare to reference the coding guidelines for COVID-19 infections. Guideline IC-1G-1G discusses signs and symptoms without a definitive diagnosis of COVID-19. Some signs and symptoms of the COVID infection are headache, sore throat, nausea or vomiting, fever and chills, cough, congestion or runny nose, shortness of breath, body aches, and also new loss of taste or smell. As you recall, shortness of breath is one of the signs or symptoms of COVID-19. For patients presenting with any signs or symptoms discussed in the last slide, such as shortness of breath, and where a definitive diagnosis has not been established, you will assign the appropriate code or codes for each of the presenting signs and symptoms, such as ICD-10 code R06.02 for shortness of breath. A definitive diagnosis is the final diagnosis provided based on information obtained from physical examinations and diagnostic tests. A positive COVID-19 test means the virus was detected and the patient has or recently had an infection. When COVID-19 is diagnosed, signs and symptoms are not coded. When a patient is diagnosed with COVID-19, understand that signs and symptoms are not manifestations and would not be separately coded. Another ICD-10-CM guideline, ICD-10-CM, states that signs or symptoms that are associated routinely with a disease process should not be assigned as additional codes, unless otherwise instructed by the classification. The first guideline we will review for COVID-19 is ICG-1B for sequencing of codes. What is sequencing all about? When COVID-19 meets the definition of principal diagnosis, coders should sequence ICD-10-CM code U07.1 for COVID-19 first. The appropriate codes for associated manifestations should come after this. There is mention of other situations in the guidelines, but for now, we will not discuss them. In this scenario, a patient in the emergency department was diagnosed with COVID-19 infection. A week later, the patient returned for the second time. The emergency department physician diagnoses the patient with bronchitis due to the COVID infection. So, the COVID infection caused the bronchitis. The instructional note in the tabular list under the code for the COVID-19 infection directs the coder to use an additional code to identify pneumonia or other manifestations. Therefore, when a patient presents with an acute manifestation of COVID-19, such as pneumonia, bronchitis, or ARDS, the COVID-19 infection is sequenced as the principal or first diagnosis, regardless of whether the patient's most recent COVID-19 test is positive or negative. Now you know that the COVID-19 infection is coded first. What about the ICD-10-CM code for bronchitis? The first step is to look for the main term in the alphabetic index for the condition or conditions. When referring to the alphabetic index, you will see that bronchitis has many differences. Pay attention to the differences in the codes, especially the subterms and keywords. So let's find the differences in the code descriptions in the ICD-10-CM alphabetic index. Look for the main term of bronchitis in the alphabetic index and jot down the possible codes for the bronchitis. For a patient with acute bronchitis confirmed to be due to COVID-19, assign codes U07.1 and J20.8 for acute bronchitis due to other specified organisms. Bronchitis not otherwise specified due to COVID-19 should be coded using U07.1 and J40 for bronchitis is not specified as acute or chronic. The physician told the patient that COVID-19 caused the bronchitis. The physician did not mention whether the bronchitis was acute or chronic. This is something to think about before assigning the code. Look at Guidelines section IC-10-CM located under coronavirus infections for acute bronchitis. After you find the most descriptive codes that identify bronchitis, take time to review the codes in the tabular list. As COVID-19 pneumonia advances, more of the air sacs may get clogged with fluid spilling from the lungs' tiny blood veins. Shortness of breath eventually sets in, which can lead to acute respiratory distress syndrome, which is a type of lung failure. Patients who suffer from ARDS are frequently unable to breathe on their own and may require ventilator support to help circulate oxygen throughout the body. ARDS can be devastating, whether it occurs at home or in the hospital. Patients who survive ARDS and recover from COVID-19 may develop long-term lung scarring. Let's say the patient is diagnosed with COVID-19 and later develops respiratory symptoms. The physician tells the patient he or she has a diagnosis of acute respiratory distress syndrome due to the COVID-19. Take time to refer to the ICD-10-CM coding guideline IC-10-G1-4 ARDS due to COVID-19. According to Guidelines section IC-1-G4, cases with ARDS due to COVID-19, the first listed ICD-10-CM code is U07.1 and the second listed is J80. Diagnosis code B34.2 for coronavirus infection unspecified is not the appropriate code for COVID-19 because the cases have universally been respiratory in nature, so the site would not be unspecified. Some long-term effects of COVID-19 include insomnia, changes in smell and taste, shortness of breath, chest pain, palpitations, dizziness, sadness, and anxiety. In some situations, the symptoms are so severe that individuals are unable to work or simply go about their typical daily activities. In these situations, ICD-10-CM code U09.9 is secondary to specific codes for ongoing conditions after a COVID-19 infection, such as dyspnea, chronic fatigue, and ICD-10-CM codes for any long-term side effect of COVID-19. This is supported by the instructional note at code U09.9, which instructs us to code first the specific condition related to the COVID-19 if known. COVID-19 post-acute sequelae are regularly described in people recovering from the virus weeks to months after the acute infection. ICD-10 code U09.9 is used to indicate complications, such as muscle weakness, headaches, and decreased lung function. When connected to a previous COVID-19 infection, the ICD-10-CM tabular guideline for reporting U09.9 advises using this code to identify the following conditions: chronic respiratory failure, loss of smell or taste, multisystem inflammatory syndrome, and pulmonary embolism or pulmonary fibrosis. If the provider documents suspected, possible, or probable COVID-19, do not assign ICD-10 code B97.29. Assign a code or codes explaining the reason for the encounter, such as fever, or report ICD-10-CM code Z20.828, which is for contact with and suspected exposure to other viral and communicable diseases. If the provider documents non-infectious or not infectious COVID-19 status, this indicates that the patient no longer has an active COVID-19 infection. Therefore, you would assign code Z86.16 instead of U07.1 for COVID-19. That's it for the ICD-10-CM guidelines for COVID-19. I hope this helps in solving your assignment questions. Stay tuned to learn more from upcoming videos. Please like and subscribe to my channel. Feel free to leave a comment and share with a fellow classmate. Thank you.